Hello everyone, I am Dr. Vidyasagar Chandankere, pediatric orthopedic surgeon at KIMS Sunshine Hospital. So today I'll discuss about a very common problem in children that's called as clubfoot or CTEV. The main thing is the parents are worried whether there is a treatment and whether my child will be able to walk, all the milestones will be normal. So I'll answer all these questions in 2 to 3 minutes now. So first of all, clubfoot is a treatable condition and almost it becomes normal. Children can walk, run, do the normal activities what other children do, and there is no disability if you take the treatment properly. So how do we recognize it? Once the child is born, sometimes even in the antenatal scans, when the mothers get the scan, it might come as a clubfoot or CTEV. So there is a deformation of the foot. And even after delivery, the treatment usually starts after delivery only. So we note a deformity in the foot of the child, which is crooked, the foot looks crooked. And at that point, the treatment can be started. Generally, the best time to start treatment is when the child can visit your OPD regularly. If the child is in NICU, no need to hurry for the treatment. When the mother and child both are comfortable, they can attend OPDs and undergo serial casting. So the treatment consists of 2 stages. First stage is the correction and second is the maintenance stage. So only when you get corrected foot, then you start maintenance phase. What happens in correction phase is generally we do serial casting. Every week we put plasters in the OPD and slowly we correct the deformity. At the end of the correction, we may need a small procedure or surgery called as stenotomy in most of the children. And then the final cast is there for about 3 weeks. And once the treatment is over, we start the maintenance phase. We give a shoe, foot abduction brace we call it, and that has to be worn and the timings will change depending upon the age of the child. But that has to be worn at least till 4 to 5 years of age to avoid any recurrences. And once you get all these things corrected, child milestones, the walking, running, everything is almost normal. Very rarely some children may recur and they might need a tendon transfer at the age of 4 years or so. But it's a totally correctable condition and parents need not worry, and treatment can be sought out easily at any centers which is near you. So another question generally parents ask is, what is the duration of brace which we should use? So normally when the baby undergoes stenotomy, we keep the cast for 3 weeks, and once the child is out of cast, we start on those foot abduction orthoses or braces. My protocol, what I follow is for 3 months they are in brace for full time. That is almost 23 hours I ask them to use the brace. Only during bathing and some activities which might need care, the child can, parents can remove the brace. But otherwise 23 hours for the first 3 months, and then gradually I reduce the timing to 18, 16 and then 14 hours. So later on that 14 hours protocol I continue it till at least 4 years of age, and some children I extend it till 5 also. So another common question what the parents ask is why the frequent follow-ups? The recurrence rates are high during the early phases. So that's why the follow-up duration is advised in such a manner that as the child grows older, the follow-up becomes less and less frequent. So initially the follow-up is monthly in the brace, and I would like to see the children, parents put the brace in front of me when they are putting it for the first time, so that I can show how to do it properly and what to avoid. And then once this braces duration keeps on reducing with age, the recurrence also is less. That's why the follow-up is initially monthly, and then I make it every 3 months once, slowly going to 4 months, and once they become of 4 years age, I do it every year until skeletal maturity. That's what I recommend. Thank you.